now we're going. All right, so everybody and anybody, tell me what we're seeing here so I don't have to talk so much.
So that's the aortic arch.
First, before the arch.
Oh, the aortic trunk.
Ascending.
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 Aortic
Arch.
Descending.
Descending. The
Cephalic.
Cephalic.
Brachiocephalic.
Branches into the
Mhm.
left common
There it is.
carotid, the right common carotid, and then the right subclavian.
Yes. So this one is the
Right
Right common.
subclavian.
right subclavian,
Oh. Right common.
Right common.
Left common.
which are also here.
Is that there?
Here.
There. Okay.
Subclavian dives through here and becomes what and what?
The
Right
axillary
axillary.
and then brachial.
Right brachial.
Veins,
The superior vena cava.
right?
The I don't know.
Mammillary.
Mammary.
Internal
mammary.
mammary.
Comes up and splits.
Breaks into
Left and right brachiocephalic.
Right.
veins.
brachiocephalic.
Brachiocephalic splits into
Right and left subclavian.
one brachiocephalic splits into this guy and this guy. This is the other subclavian way over here. Brachiocephalic splits into anybody? What's the one going up to your neck?
I really don't know.
What's that vein right
The
there?
jugular?
Yeah. External jugular.
Okay.
And then this one is the... I know, I'm asking you.
I don't know.
Brachiocephalic becomes the right subclavian, which becomes the axillary, which becomes the brachial. Okay? So this is the subclavian here.
Okay. Then axillary.
Turn into the axillary, turn into the brachial.
Brachial.
This is the jugular, external jugular.
Yeah, that little
Internal
one.
jugular.
That's internal jugular, which runs up with the common carotid.
Okay.
Come up here, and sometimes you can see it, sometimes you don't, but if there were one right here, what would it be?
Oh, that's the connecting one to the jugulars.
Right.
Transverse
Transverse jugular, right. And then this guy, then this one,
Transverse scapula.
transverse scapular, going down to the scapula.
Okay.
Okay? Now I just flipped left some rights on you.
It's okay. It's always the patient left. Patient right.
Right, correct. So we've got
In this case, that's
this coming down, going here, which is,
ascending or descending aorta.
so here.
The celiac.
Mm-hmm.
And then I just know where they go. I don't remember the order.
Hepatic,
Hepatic is first.
Left
gastric.
gastric.
Left gastric is second, which makes this the
Splenic.
splenic. And
That's
then
the gastric.
the just regular old gastric. And you work your way up here, splenic, which splits into
Anterior and posterior.
anterior and posterior
And
splenic.
anterior is on top, correct? Okay.
Because that's anterior for the
Okay.
cat. This is,
Cranial mesenteric.
Okay.
and what splits off?
The
Middle.
Middle
colic,
colic, which wraps around here, becomes the,
Left colic.
and comes back out as the,
Caudal mesenteric.
and then this going down,
Cranial.
cranial,
Hemorrhoidal.
hemorrhoidal. Coming off of the dorsal aorta, comes over here and comes down on here.
adrenolumbar.
Adrenolumbar.
You might have to do the other side on that.
It's right there.
That's the rectal aorta.
Not rectal.
Oh,
but-
adrenolumbar.
No.
Nope.
Renal.
On the right,
Renal.
good. Renal?
I was close.
Renal?
Renal.
Not really.
Oh. Okay, close in my mind. I need to get
Close
my
in
letter.
spelling, not in area.
Yeah, definitely not.
This guy, and you actually have two of them.
Genital.
Mhm.
arteries.
Genital arteries. The other one is right there.
No, this
they
is a
have-
girl, right?
It is, because going over here to the ovaries. Here and here.
I don't know.
Deep.
Ileal.
Ileal.
symphysis.
Yes. Mm-hmm.
And then you have the four branches.
Is that the
External.
and internal?
External what?
Femoral?
Nope.
No.
Ilio.
Iliac.
It's by the iliac.
This one here,
The
Internal.
internal,
Iliac.
Iliac.
and then the external iliac turns into the,
Femoral, right, left and right femorals.
which gives off,
It's down in there.
there it is,
The deep,
right there.
femoral.
Deep
Mhm.
femoral.
Veins.
Okay.
Big guy.
Posterior vena cava.
This one.
Adrenolumbar vein.
This one.
Um,
Renal vein,
Renal vein. That guy.
genital vein.
And there is another one coming off that didn't stain terribly well, but there it is. You can see it coming off of the vena cava.
it just
There.
didn't stain.
Mhm.
Okay.
And then we named these in the arteries. So again, with the vein, it's the,
Deep
Ileal circumflex.
vein.
yes. And then down here, the split is the,
Ilio.
Iliac vein.
common iliac vein, which then splits into
External.
And internal.
external here, external iliac here, internal iliac here,
Okay.
and then continues on as the
Femoral.
femoral
vein.
with the,
Deep femoral.
good, right. That's everything.